guys, my name is Adrienne. I'm a speech therapist, and today I'm going to talk about how to make the most of therapy appointment services, because in the end, as a speech therapist for the last 23 years, in the end, I don't want to see your kid anymore. Like, no offense, but I think you want that too, right? You want there to be a time where maybe your child doesn't need therapy services anymore. And there's a longer way to do it, and there's a quicker way. And let me say, every kid is different. And you could do all of these things, and the process still take longer than you would like. But what I found in my private practice and as working as a speech therapist in a school and all those things, these things work, okay? Number one, come on time. So if your kid's being seen at school, make sure they're at school the days they have speech. If they're coming to a clinic or a center, make sure that they are there and they are on time. When I see parents running in, and I get it, like, these are very busy times, and you get points just for like signing your kid up and doing the work. Like, we really appreciate that. But even if they're late 5 minutes, then after 5 or 6 times that you've done that, it's like they've missed the whole session. So consider that when you are like running late for things, right? Be honest about your schedule and what you can do. Not saying though, hey, you're 10 minutes late, you may as well not come. Is something better than nothing? Yes. But when it comes to therapy, we want everything. All right. All right. So the next thing is, if you're not going to make it, make sure you call. A lot of times, some of our parents will say, I have a doctor's note, but they won't call us to say that the child is going to be out. And if you are late canceling or not coming at all, it really bothers us. And I know for some of us, it's like, well, I couldn't make it and I tried. We do appreciate that, but there's planning that goes into this session. There's money on the line. Is this all about money? No. But when there's a spot open and it's like a no-show, it's really hard for us to stick somebody in there, especially if it's last minute. If you happen to have missed a session and you couldn't call, hey, my car broke down, I had to take a relative to the hospital, call after the fact. And sometimes if it's difficult for you to say, send an email or something, just so we know, hey, this parent is invested and they care that they missed it, right? So consider that as you are going through this. And let me say, a couple of years ago, I had a really bad car accident, and I was having to have physical therapy 3 times a week. And even in my schedule being very flexible and everything, 3 times a week was really a lot. So I do want to say to all the parents, because I see parents even in our office, you're rushing home from work or picking your child up, trying to get them to therapy. We really do appreciate the work that it takes to make sure your child is getting therapy services. So I do see that. And doing something more than once or twice a week gets to be really a lot, especially on top of life. So as you are planning, did you see my light go out? As you are planning your year and as you are planning other things, be honest about yourself. If therapy works for your life, like we used to tell parents that all the time, sometimes it just doesn't work for our life and they just have to have it at school, or I'm going to send my child to school, or so you have to be honest, because you want to not be a total dish rag at the end, right? Okay, I'm off of that. The next thing is practice at home. I know that, and one of our therapists, beloved therapist, said something so profound to me that I want to share with you. On our end, sometimes it feels like parents want to drop off their kid that has a problem. They're disordered in some way. Disorder is a very strong word, but there's something wrong. Like they're not quite doing this yet, or they need something, they need help. it feels like they want to drop the child off and then pick up a child that's all fixed. And unfortunately, in the world of therapy, and I'm just going to say it, in the world of therapy, in the world of autism, in the world of CP, anything of this nature, it just doesn't work that way. The at home practice, the connection at home is what makes the difference between success and not success. I'm just going to be honest. So consider that. Even if it's 5 minutes, and sometimes by the time you get them home, go through homework, dinner, bedtime, it feels like, well, when will I do it, Adrienne? But 5 minutes a day, so do it in the mornings. Or do, like, if you can find 5 to 10 minutes to practice the skills that they're practicing in therapy, it makes all the difference. I think a lot of times parents, humans, want to do things in a big way or not at all, when actually the small things are what makes a difference. I used to teach a long time ago, make everyday moments teachable moments. So those moments in the car line where you're waiting, you can sometimes get more done then than acting like you have to be a teacher at home. Like, okay, sit down for 30 minutes and then we're going to do all these things. You don't have that kind of attention span, and quite frankly, neither does your kid, and that's okay. But if you just practice that 5 minutes a day, you would see a world of difference. And don't be discouraged if they say, I don't want to do it. No, I don't want to go to the gym, but I do that, right? So there's a lot of things we don't want to do. Or sometimes, like, if the kid doesn't do it like they did it in therapy, you're like, well, it didn't work. No, keep trying, all right? Because if it worked the first time, there's probably a probability that you probably wouldn't need us at all. So you might have to be in there, give yourself a minute, and like, you've got to find a rhythm too. So at-home practice is the key. I've got 2 more. Be willing and open to recommendations. From a speech therapist standpoint, I don't ever want to put a label on a kid. But I have noticed from working in schools, daycares, preschools, everything, if caregivers, and when I say caregivers, caregivers like your teachers, their child's teacher, their therapist, if there's something hanging in the air, like we're wondering if something's happening, it's like unknowingly, it's like this gray area. And so we just want a yes or a no. And so it's really helpful when you take those recommendations for other testing, for other therapies, and at least investigate it. Because we are not, I guess I can't speak for the entire profession. I can't speak for me. I'm not necessarily saying, oh, I think your child needs to be at least tested so we can diagnose or rule out autism. Or I think we need, he might need a frenulum, the tongue tie clipped. Or I think your child might need ABA to start. Nobody wants to just pass along kids or give people labels, but knowing that information is really key. And one more thing, if they're 4 or under, don't be afraid to do the testing. Kids get so many more so much more access to services under the age of 5 that is private, right? Early steps, private therapy that you can or cannot disclose once they get to school or whatever. But a lot of times I see parents almost waiting until they're 5 or till they go to kindergarten. And if your child needs big services, like autism testing, or they're like really delayed, getting that under 5 and them having a journey through school is way easier than waiting until they get to kindergarten. Because once they get to kindergarten, there's a process that every public school has to go through to start testing. And that a lot of times will mean like at least a 3-month series of treatments or things that you will try before you test. And so consider that. And no one knows more than me how difficult some of these things are to hear. And I think if there are any professionals watching this, I think sometimes professionals can do a better job across the board. Doctors, nurses, therapists, of telling parents this in a way that is honoring and that is gentle. Nobody wants to hear in passing, I think your kid has autism, or I think your kid's delayed. Like, sometimes I think we say it so much, we're just saying it, but we have to be aware of the audience on the other end. Okay? And the last thing is, breathe before you yell. And so I've been yelled at a lot as a speech therapist, and I actually get it, right? I think the only person that can be a advocate for your kid is you. But there is a way that you can advocate for your child without yelling, without screaming, without cursing, without trying to just mow somebody over because maybe they're a young therapist or they're overbearing. There's a way you can advocate that makes you more of a team than enemies. Once you yell at a caregiver, a home caregiver, a ABA therapist, a speech therapist, OT, a teacher, it's really hard to come back from that. Like, it's hard for someone to yell at me and then work with their kid and not still remember that. Do we retaliate? Absolutely not. We're called to do it. But if you're mad, and sometimes, as the kids say, if you're big mad at us for whatever reason, first breathe. Like, it might be a good idea to wait a day. I mean, the situation will still be the same, right? But once you yell, it just compromises the trust. And for therapy to work, I have to trust you as a parent, but you've got to trust me. So keep those things in mind. I know that I don't always like to be, I hope this talk didn't turn out harsh. I never want it to be harsh. I am so appreciative. If you're part of our practice, Speech Builders, I'm so blessed, and I feel so grateful that you trust us with your little one. But I do want you to know our side of it, because we're not only seeing your kid, but possibly we're seeing children all day long with all kinds of behaviors. So partnering with us as a team will take you and your child far. And that's all I have for today. Until next time, I want you guys to make those everyday moments, those teachable moments. Only 5 minutes.